Why are people suddenly getting COVID 19 this summer? Here's an insight into the uptick. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. According to USA Today magazine, just as summer gatherings begin, Americans are catching COVID 19 again. Cases predictably rose in uptakes during the winter with more people indoors. They are also increasing as experts expected at the start of summer. Centers for Disease Control and Prevention data shows small jumps in hospitalizations and deaths and slight increases in new cases. This latest rise in cases shows how the virus has persisted 4 years since the start of the COVID 19 pandemic. When you begin to see a pattern, then you might say it's becoming endemic. Dr. Jesse Jessman, a professor of epidemiology and medicine at Columbia University, told USA Today. When something is endemic, that does not mean it's going away. That means it's staying around. Quote, close quote. Another common endemic disease Americans have learned to prevent routinely is seasonal flu. SARS, CoV-2, like any virus, is constantly mutating, so it can infect more people and survive. New variants and subvariants expand outward like branches from trees, each with different mutations, seeking to adapt. As the changes begin, health experts and officials have responded with vaccines and other protections to reduce the risk of serious illness or overwhelm health systems. The uptake from the latest subvariants are nowhere near the levels the U.S. experienced in 2020 or when the Omicron variant began to drive cases and deaths across the globe in 2021. Hospitalizations and emergency room visits are far less frequent this summer than in December. Deaths have not reached the levels of this winter when more than 2,000 people died from COVID each week. In January, in the latest CDC estimates as of June 15, fewer than 150 people died of COVID 19. Cases are driven by consistent uptakes in a collection of subvariants known as FLIRT, F-L-I-R-T, named for the mutation's technical names. FLIRT derives from the JN.1 variant, descended from Omicron, which dominates cases until the spring, according to the CDC's noun case loose estimates of circulating variants. Now, FLIRT increasingly causes cases in the U.S., the largest in the KP.3 subvariant, which accounts for about a third of cases, followed by KP2 and KP.1.11, CDC data shows LB.1. derived from JN1 also accounts for a substantial portions of estimated circulating variants. The western U.S. and Hawaii have experienced increases in recent weeks, CDC data showed. However, wastewater samples, a surveillance tool to detect COVID-19 spread across the U.S., appear to show increases in the virus's spread. Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy, said a portion of the new cases involved the FLIRT variant. However, he noted that the U.S. lacks good surveillance this late in the pandemic. It's fair to say that there is an increase, he said. What we don't know yet is how much it's going to be. FLIRT may be more transmittable, particularly because of mutations that makes it easier to shield the virus from antibiotics, according to Andy Peskos, a professor of molecular biology and immunology at Johns Hopkins Bloomberg School of Public Health. In a Q&A in May, but it doesn't seem to cause more severe illness or prevent different symptoms. Vaccines provide protection against COVID-19, though they may wane over time. The last vaccine in late 2023 targeted the XBB.1.5 variant in February. The CDC updated its guidance for people 65 and older to get a booster of the current vaccine. In early June, a Food and Drug Administration advisory panel recommended vaccine makers to target the JN1 lineage. A new round of vaccines is expected in the late summer or early fall. People experiencing respiratory symptoms should reduce the spread of the virus by staying home. They should also contact health providers for treatment if they are at serious risk or illness. Experts continue to recommend wearing a mask and distancing to reduce transmissions of COVID-19. I'm Tyrone Bowman. Thank you for watching. Never surrender. Never.